All right, guys. So today what we're going to be doing is we're going to be seeing a patient who's having some COVID-19 type headache. And so really important to talk about this. I'm seeing a lot of COVID-19 and a lot of headache in patients, especially with severe headache. This is sponsored by Mayapur Community Hospital. So Mayapur Community Hospital, go ahead and hit the link below if you want to donate to our efforts. We have a free clinic, a free neurology clinic, and that I work closely with the Mayapur Community Hospital here in India. The second thing is you please check out our book, and are sponsored also by directly. We're sponsored by the NAS Academy, and we really appreciate your help in joining those courses. So go ahead and click on the links below. So our sponsors are below on the links. This is a free clinic, and we are just waiting for our patient. Hello, Prabhu.
Hello, Prabhu.
Good morning.
Hare Krishna, Prabhu.
Hare Krishna, Madhugopal Prabhu.
Hare Krishna, Prabhu. Dandot Pranam, Prabhu. Hare Lila.
உடம்பு சரியில்லையா?
Srinivasa Hari Prabhuக்கு உடம்பு சரியில்லை பிரபு.
யாருக்கு?
Srinivasa Haridas.
ஓகே ஓகே.
டெம்பிள்ல இன்மே
Okay. Hare Krishna, this is Vinay Gaur Chandra Das. Can you show your video?
Hare Krishna, Dandot Pranam, Prabhu.
How are you? How are you? Hare Krishna, Prabhu.
Hare Krishna, Dandot Pranam. Prabhu, we'll be joined by Srinivasa Hari Prabhu in 2 minutes, Prabhu.
Okay, wonderful. Srinivasa Prabhu is on. Who's our patient?
Srinivasa Haridas. He's the
Yes, bro. Hare Krishna, bro. Hare Krishna.
Oh, you look good. How are you? Tell me.
Prabhu, actually, for the past 4 days, I am having continuous headache.
Continuous.
Headache, yes, Prabhu.
Okay.
And again, for the past 4 days, dysentery also is there.
Okay, so
And
are you diagnosed positive with COVID-19? Yes, no?
yes, Prabhu, COVID-19, I was diagnosed positive, and I was admitted in the hospital also, and got discharged on 14th.
Okay. And since that time you've been continually having headache since the beginning, or did the headache come out afterwards?
After discharge, Prabhu. After discharge, 4 days after discharge.
They gave you steroids?
4 days after discharge. Prabhu?
They gave you steroids? Did they give you steroids?
Yes, Prabhu. They gave remdesivir. Remdesivir injection.
Okay.
Remdesivir injection, they put six injection.
Okay. Okay. And how are you? Did you have trouble with bleeding, or not bleeding, breathing?
But no breathing trouble, Prabhu.
No trouble with breathing. Okay. So tell me from the beginning. You're admitted to the hospital, then you come all the way to this point where you're now having headaches. Tell me what happened before. What day exactly did your symptoms start?
Dysentery starts on, I think, 18th, Prabhu. 18th.
Okay. So it started on
18th onwards. And
okay.
Headache also on from 18th onwards only.
Headache since the 18th also. Okay.
Yes.
Okay. So how bad was your headache? Was it a quick headache? Did it come on suddenly where it was crushing headache, or was it just slow onset getting worse?
It is actually always it is there, but in the evening it is increasing. In the evening around 7 o'clock onwards, it is increasing like anything.
So it's one of the worst headaches of your life, or?
Headache, I'm able to tolerate, but continuously it is pinching pain.
Okay, pinching pain. Okay, so this, as you know, we talked about this. This is going on a neurology board review group. It's and our Facebook group, so it's a pretty big group. So you'll have other neurologists probably chiming in to give what their thought process is on this. So what I want to do is I want to talk about just the breathing issues. What's your last saturation? What's your blood pressure? What are your vital signs? Have you been taking these things?
Yes, Prabhu, I have taken, yesterday the oxygen was saturation 96, Prabhu.
Saturation is 96?
96.
Excellent.
And the day before yesterday also 96 only.
Okay, got it. So they gave you the remdesivir, you felt better, and now you're sort of getting better, but you're having these continuous headaches. Do you have a history of headache?
No, Prabhu. Headache actually, at the time of admission, before admission also, I was having headache and fever before admission to the hospital.
Okay, so before admission you're having headache and fever, and then now you're having this. Okay, got it. And when you
after stopping,
put your head down like this and you lift back up, is there neck pain? Can you do this for me?
Neck pain is there, Prabhu.
Neck pain is there. All right.
Neck pain is there.
When you press down, you have neck pain and sort of some issue. Do you feel stiffness here in the neck?
Actually, neck pain I'm having for a long time, Prabhu, for more than at least 3 years.
So that's not that's not really a new issue. Headache has been there. Where does it hurt in your head?
This both sides, Prabhu.
Both sides, right here. Oh boy.
Here.
Say 10 is the worst kind of pain. What kind of pain are you having?
Prabhu?
Say 10. Say on scale of 1 to 10. Maybe Haridada Prabhu, you can translate. But 10 is the worst kind of pain. Like say that on 1, 2, 3, 4,
Yes,
5.
I'll try to translate. Hare Krishna Prabhu. இப்போ உங்களுடைய ஹெட்டேக் வந்து உங்க தலைவலி இருக்குல்ல, அது வந்து 1ல இருந்து 10 வரைக்கும். இப்போ 10 தான் ஒர்ஸ்ட் தலைவலி, தாங்கவே முடியாத தலைவலின்னு வச்சுங்க, 10ஆம் நம்பர் மார்க். 1 வந்து ரொம்ப மைல்டான தலைவலின்னு வச்சுங்க. அப்படி பார்த்தா 1ல இருந்து 10 வரைக்கும் உங்க தலைவலிக்கு என்ன மார்க் போடுவீங்க?
மார்க் போடுறது அப்படின்னா ஹெடேக் வந்து ஒரு 7 போடலாம் ப்ரோ.
7
போடலாம்.
7னா உங்களால வந்து கிட்டத்தட்ட வந்து ரொம்ப கஷ்டமா இருக்கும், அந்த மாதிரி இருக்கும். இப்ப நீங்க வந்து 10 வந்து தாங்கவே முடியாதுங்கிறது, அப்ப 7 போட்டீங்கன்னா ரொம்ப ரொம்ப கஷ்டமா இருக்கு அப்படின்னு அர்த்தம். அந்த மாதிரி இருக்கா? இருக்குன்னா இருக்குன்னு சொல்லுங்க. ஏன்னா இருக்குன்னா இருக்குன்னு சொல்லுங்க.
அப்படிதான் இருக்கு. எனக்கு ஈவினிங் டைம் அப்படிதான் இருக்கு.
சோ காலை நேரத்துல
வந்து 3 இருக்கலாம், 3 or 4 இருக்கலாம், அவ்வளவுதான்.
சோ
ஈவினிங் ஒரு 7 o'clock இருந்து 7 சொல்லலாம்.
Dr. Vinay, so he is saying that morning time you can rate it at 3 or 4, but evening from 7 o'clock it goes to 7. The score goes to 7.
Okay. All right. So you look very good. Can I see you walking? I just want to see you walk in the room. Can I see you?
Now you want to see me walking?
I want to see you walking in the room if possible. Possible?
Okay, bro. Yes, Prabhu. I have to now remove the wire.
No problem. If you feel dizzy right now, when you just stood up, do you feel dizzy?
While sitting, Prabhu, no dizziness at all.
When you just stood up, any problem? Right when you got up, did you feel dizzy?
No, Prabhu.
Okay.
No.
Go ahead and walk for me, but don't bump into things. Don't hurt yourself. It sounds like a small space. So just go ahead and walk for me. Just a couple steps walk and then walk back.
Okay, bro. I'll do that now.
Okay, can I just see your feet? How do you feel? Do you feel steady or do you feel unsteady?
Steady only, Prabhu.
Steady. Okay, go ahead.
I'm feeling steady only.
Okay, can you sit back down? Okay, can you do this for me? Do this. All the way out. All the way. Like this. Good. Good. Can you do this? Okay. Good. Close your eyes really tight. Close your eyes really tight. Close, 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 close. Open your eyes. Okay, good. Look up. Just look up for me. Okay. Now just look up. Don't move your head. Look down. Don't move your head. Just look down. Don't move your head. All right. Look to the left. Don't move your head. Look to the left. How do you say left? How do you say good? Look to the right.
Some heavy feeling is there.
Heavy feeling in your head. Okay. All right. Look to the right. Look to the right. Okay. Good. What is your blood pressure today?
Blood pressure, I'm not checking, Prabhu. I'm checking only blood sugar, and then this is the oxygen meter. That's all, Prabhu. Blood pressure, I'm not checking.
What was your last blood sugar this morning?
Yesterday morning, fasting sugar 155.
Okay, 155.
Fasting sugar 185. Day before yesterday, fasting sugar 184.
155 then to 184. Okay. Okay. So let's do this. Let's your fasting sugar is a little high, no? Little high.
Correct, bro.
So what's your
184 also?
Who's handling your diabetes?
One diabetologist is there, Prabhu. As per his treatment only, I'm taking insulin and tablets.
Okay. Is it usually is it usually lower than 155? It should be about 120.
What, Prabhu, actually?
Is your blood sugar usually higher, or is it usually lower than it is?
It's higher only, Prabhu. Always higher only.
Okay. Let's see. What did you take for the headache so far? Have you taken Tylenol?
Headache.
Have you taken paracetamol for headache?
No, I took the Dolo 650. I took actually.
You took Toradol.
Dolo 650.
Doro 650.
Dolo, DOLO.
DOMO. I don't know. Let me see what the generic.
Paracetamol, Prabhu, you are correct. Vinay Chandra, Prabhu.
It's paracetamol. Okay. So you took. Okay. All right. So you took the paracetamol 650. Okay. So and the Domo is not helping.
Prabhu?
Domo is not helping. Paracetamol, it's not helping. Does it help your headache? Yes or no? Does it get better?
No, it is not working actually. Even if I take Dolo 650 also, headache is not reducing.
Okay, so this is a difficult situation because you have this diabetes, and in addition to that, you also have a headache that's going on. I know a quick fix for your headache that's worked in other patients, but the problem is that your diabetes has to be very well controlled. So I actually need you to take your blood sugar 3 times per day there, and I want to put
3 times. Okay.
Small dose of, I would usually use IV steroids. I would treat you with IV steroids with 1-2 doses, and it will finish it. The problem is that if I give you this and your blood sugar goes up, then I've fixed one problem, I've caused another. Can you translate? How do you do that? Because sometimes I'm too fast.
அவர் டாக்டர் என்ன சொல்றாரு, உங்களுக்கு வந்து இந்த தலைவலி இருக்கிறதுனால வந்து ஐவி ஸ்டெராய்டு கொடுக்கணும்னு சொல்றாரு. இந்த நரம்பு ஊசி போடணும்னு சொல்றாரு, ஸ்டெராய்டு போடணும்னு சொல்றாரு. ஆனா ஸ்டெராய்டு போட்டா அது என்ன ஆகும்னா
Okay.
பிளட் இன்க்ரீஸ் ஆகும். அதனால என்ன பண்றதுன்னு யோசிக்கிறார்.
Hmm.
அதனாலதான் அவங்க பிளட் சுகர்
That's actually that.
Go ahead.
Even even in the hospital also, when they gave IV steroid, my sugar went up like anything.
Yeah.
300, 350, like that it went.
So that's when it gets scary, because then we can cause another problem. You can actually go to the hospital because of that reason also. So, how much insulin do you inject? Long-acting insulin.
Actually, morning before food, I'm taking 10 units before prasadam, and again after prasadam 10 units. Then afternoon before prasadam 10 units. Then night before prasadam 10, after prasadam 16. 1-6.
1-6. So it's 10, 10, 10, 10, 6, 1, 16. So 5 times in a day.
Correct. 5 times a day, yes.
Okay. So then, okay, so 10, 10, 10, 10. And then how about the long-acting one? Is the long-acting one the 16 units? That's the long-acting? And then
Yes, bro. Long-acting is
all the 10, 10, 10, 10. Okay.
10.
So, yeah.
Humalog is the
16 is Humalog.
Humalog is short-acting, and Lantus is the long-acting.
Lantus is long-acting. And Lantus, you're taking 16. And the short-acting Humalog, you're taking 10,
Yes,
10.
bro.
So 4 times. Okay.
10.
So if we can do this in one of two ways, we can probably fix your headache. But before I ask you that, did you get a CT of your brain? Have you had a CT scan?
CT.
Yeah. Did they?
No, bro. They didn't take anything.
So how easy or how hard is it to get CT of your brain? And what is the risk of you going and getting reinfected with going back to the hospital with a CT scan where you are in India? I just wondering in Bangalore. Where are you? I'm just
மதுகோபால் பிரபு.
கோயம்புத்தூர் bro.
Prabhu.
இப்போ ஒரு சிடி ஸ்கேன் எடுக்கணும்னா அது வந்து சேஃபா ஒரு இடத்துல போய் சிடி ஸ்கேன் எடுக்க முடியுமா? வெறும் ஸ்கேன் சென்டர்ல போயிட்டு சிடி ஸ்கேன் சேஃபா எடுக்க முடியுமா?
Vinay Gaurchandra, it is little risky, Prabhu, to go to hospital in these challenging times. But, yesterday, he has spoken to a doctor called Dr. Bhuvaneshwaran, who is part of the PSG hospital team. PSG hospital is the hospital in which Prabhu has taken the COVID treatment, one of the prominent private hospital in this part of city, Prabhu.
Oh, PHG. P as in Paramatma, H as in Hari, G as in Goranga, huh? PHG.
Paramatma, correct, Prabhu. S for Sydney and G for Govardhan. PSG.
PSG, G.
Yes. So he has spoken, Prabhuji has spoken to the chief doctor, Bhuvaneshwaran yesterday, the dean, and he has advised him to come today morning at 9 o'clock, means about one hour from now, for a review meeting.
But why can't he do it online? Can we call him online?
Prabhu, things have not been advanced to that level, Prabhu, here. And the COVID review setup.
Looks like the community hospital is leading in telemedicine here, huh?
Yeah, we are far ahead in telemedicine than anybody else in India.
Wonderful. Okay. So I think this is the major issue. I think that if I send you to hospital and you look so good right now, and then you come back and 3 days later you don't look so good, what's the point? Let's do this. I don't want to send you to the hospital. Let's take one risk if you're with me. Let's do this. Let's get you. Is there another doctor here on the line that can help him right now here, or a nurse? As far as getting.
Nobody is the medical background. Sorry, Prabhu.
Okay, then no problem. Let's try this. Let's not do a CT scan. If Harilila Prabhu agrees, we can do two things. Let's not do a CT scan at this time. Let's just, because he looks neurologically okay and intact. And if we go back to the hospital, we risk the reinfection. So let's just give him. Let's increase your Humalog. Let's give you 10 milligrams in the morning and 10 milligrams at night of prednisone. Let's do that. And then let's increase your long-acting. What is your morning glucose? You said 150. So let's increase your long-acting to
155.
155. So let's increase, and you said 185 thereafter, right? 155 was one, and 185
Yes.
is thereafter. Okay. So then what we should do is let's increase your nighttime insulin, your long-acting. Let's go up by 2 points. Let's go from 16 to 18. So I'm going to write this down. So we're going 16 to 18 on the Lantus, not the Humalog.
Lantus.
Yeah, on
Okay.
Lantus.
Humalog, Prabhu?
And then Humalog, say your morning sugar is going too high, we'll go up by 2 points. So you'll just be on the group, you'll tell me what your morning sugar is every morning. Okay, for the next 2-3 days.
Okay, Prabhu.
So what we'll do is we'll give you 10 milligrams of prednisone now. I want you to go get, or ask somebody to please go bring you 10 milligrams of prednisone. Let's see what that does to your headache. And then let's also give you 10 milligrams in the evening of prednisone. I don't want to start you on other things like amitriptyline, which will make you sleep at night. I don't want to give you Depakote. I don't know what your liver enzymes look like. I also can give you these other medications, but they all have different side effects. Let's just do prednisone for about 3 days, see if your headache goes away. It's a 7 out of 10 headache. I bet it'll come down to about 3. Okay, and then we'll see what we can go from there. Okay.
Okay, Prabhu. So that is night Lantus is 18 units, Prabhu. Humalog 10, 10, 10. Same thing I should continue?
10, 10, 10. Night,
10, 10, 10. All 3 times.
let's go to 18.
இல்ல ஹியூமலாக் 10க்குல இருந்து 12க்கு போக சொல்றாரு.
Because Humalog,
12, Prabhu?
don't change it to 12 yet because we don't know what that sugar is going to be in the morning. When we know what your sugar is in the morning, then we'll adjust it. Say your sugar is high, 180, 190. Then we'll go to 12, 13.
Okay.
For short act. But say your sugar is low.
Right.
You know, say your sugar somehow became low because of the Lantus. Then I'm overshooting. So I don't know what I'm reading. So we have to gauge it by your sugars. So 3 times per day you should be taking your sugars. You need a blood pressure machine.
I have glucometer, Prabhu.
No, blood. How do you do that, Prabhu?
blood pressure எடுக்கணும்னு சொல்றாரு. BP எடுக்கணும்னு சொல்றாரு. உங்க BP எடுக்கணும்னு சொல்றாரு.
Oh, okay. BP meter also I should take. Right. I will get it.
BP meter வேணும்.
Okay. Okay. So this is good. So Srinivas Haridas.
Right, Prabhu.
Okay, this is good. Okay. So then that's basically it. So we'll do this. We'll treat your headache. Who can get him the medication today or now?
That Madhugopal Prabhu can take care.
Yes, bro. We'll arrange, bro. We'll do the needful.
You'll do the needful. Wonderful. So this wonderful doctor at PSG, say you don't get better by tomorrow, then we'll consider sending you to the hospital tomorrow. Okay, but there is one risk. There's risk if you have some difficulty or bleeding in the brain or something like that, we won't know. But still, I think you look clinically good enough right now that it's okay. But if he starts to deteriorate, then we need to treat immediately. Okay?
Right, Prabhu.
Okay?
மதுகோபால் பிரபு, இப்ப அந்த அந்த மாத்திரை எவ்வளவு சீக்கிரம் உங்களால வாங்க முடியும்?
உடனே பிரபு, உடனே அரேஞ்ச் பண்ணிடுறேன்.
உடனே அரேஞ்ச் பண்ணிடுறீங்க. ஏன்னா அவர் அந்த மாத்திரை சாப்பிட்றப்போ அவர் அந்த பிளட் சுகர் கொஞ்சம் கரெக்டா மானிட்டர் பண்ணணும். அதனால தான் 3 தடவை பிளட் சுகர் எடுத்து அனுப்பணும். அது கொஞ்சம் பாத்துங்க, அது கரெக்டா மானிட்டர் பண்ணி அனுப்பணும். ஏன்னா அது மானிட்டர் பண்ணி அப்புறம் இன்சுலின் அட்ஜஸ்ட் பண்ணணும்.
டேப்லெட் என்ன பிரபு சொன்னாரு பேரு?
Dr. Vinay, you should put the tablet name on the chat so that they can copy it.
Yes, of course. Now, here's the last period that I need you to do because we have other viewers also. So you have to tell me one thing about your meditation. How does your meditation help you? Just in quick lines as far as meditation. How has your meditation been helping you over the last few days? Or what has meditation done for you?
Meditation means there is you are saying chanting Hare Krishna.
Chanting, yeah.
It's
okay. This is actually chanting Hare Krishna. I'm not able to concentrate fully because of the pinching headache.
Because of pinching headache. Okay. So the headache is too strong.
Yes.
Okay, got it. So my request of you is to do 2 things. One is chant Panchatattva mantra, and I'll follow up with you on this. Chant a lot of Panchatattva mantra, a lot of it. That can actually decrease pain. Number two is Ugram Vidam. Okay, since you like
what is it, bro?
Ugram Vidam.
Ugram Vidam. Okay.
Like in migraine headache, say I'm having a migraine headache, I'll actually do the migraine headache. It'll take my mind off of it, off of the actual headache, and it'll allow me to do something. So it won't cure the root cause of the headache, most likely. Some people would say. I mean, how do you may disagree with me, and you may disagree with me. But the root cause physically of the headache that can be treated won't be there. But meditation can help your headache. So Ugram Vidam, a lot of it done when you focus on the headache and Ugram Vidam, it can actually decrease. So you should use that power also to decrease your headaches. Okay. How much fluid? How much are you drinking?
Drinking water per day at least some 1 liter.
1 liter. Okay.
1 liter.
And water is not helping.
And it's not helping, bro.
Okay, and then just one more question. How much, Madhugopal Prabhu, how much weight has Srinivas Prabhu lost or gained, or any weight loss has happened for Prabhu, for Srinivas Prabhu?
No weight loss, Prabhu.
Nothing. Okay, no weight loss, right?
It is no weight loss. Actually, it's 61 or 62.
Okay, can you smile for me? Just show me your teeth.
That is.
Can you do this? Just show me your teeth. Okay. Good. I think we're okay. I think you're able to walk. You're able to talk. I don't think you look severely ill. I think we can get out of this. I think your headache will come down. Just keep meditating. Get him the medication, and then increase the Lantus. Don't increase the Humalog. Just increase the Lantus, and then we'll go from there step by step. Okay.
Right.
Okay. So for our viewers, so the link for Mayapur Community Hospital will be posted in the link. The link to our sponsors are also going to be posted in the link below. Just go ahead and click below if you want to donate to Mayapur Community Hospital. Thank you. Okay.
Prabhu, Srinivasari Prabhu had been living in this room, which you correctly spotted out. It's a crampy little room, and there is no ventilation at all. He keeps the window absolutely locked. And since yesterday only, he has started the habit of lightly opening the door. So this would have been contributed.
Good point. Good point. Is there any? Go ahead, Harilila.
I mean, he should be. COVID means first of all, you should have well ventilated place. No, that's a basic requirement, right?
Yeah, you need a good ventilated place, but also secluded. So good air should come in and out.
But since yesterday, Prabhu has started opening the window. The window is giving good ventilation, and once in a while he also opens the door. So,
right. So yeah, so absolutely same thing happens to us so we're in the conch building, and we're actually in a bigger space, but we didn't open up the windows very well because even the in conch, it's so well insulated, even with the actual screen doors. So we opened up the windows fully, and we got a lot better ventilation. So it's absolutely necessary. The only problem is doing these consultations, and then of course the kirtan and all that's going on. I would agree that that's the number one thing that you should do. I didn't realize that this is where you're actually living the whole time. I thought this was your office.
24
it is
it's the office.
Quarantined in this 40 days, this room.
This is not just one room that you're actually living in.
Yes.
So major good point. So I would say, yes, please ventilate it. Now, I think what he's alluding to is, does he even need medication? Because is what he's saying indirectly to me, is does he even need medication? It's a good point.
Okay.
I say get the medication, is my opinion. It's just with COVID-19 and headache, and especially 7 out of 10 headache. I had one patient, I think with Harilila Prabhu, we had a 10 out of 10 headache. So we went for IV steroids and it went away. But if you do these steroids, I think it might be helpful right now. So I would open up the windows. If you feel better and you say, hey, I don't need this medication, then don't take it. But if it's not getting better, just take the medication, check your blood sugars, and post on the group. Okay.
Okay, Prabhu.
டோர் கரெக்டா ஓபன் பண்ணி வச்சுங்க பிரபு. அந்த கிராஸ் வென்டிலேஷன் வேணும் உங்களுக்கு.
சரி Prabhu.
உங்களுக்கு டெம்பரேச்சர் கம்மியா இருந்தது, நான் இப்ப கோயம்புத்தூர்ல இருந்து தான் வந்தேன். உங்களுக்கு குளிர்ச்சி டெம்பரேச்சர் கம்மியா இருந்ததுன்னா சால்ல போத்திங்க, காதை அடைச்சிங்க, அதெல்லாம் பண்ணீங்க. பட் வந்து உங்களுக்கு வந்து ஃப்ரெஷ் ஏர் நிறைய வேணும். எவ்வளவு ஃப்ரெஷ் ஏர் கிடைக்குதோ அவ்வளவு நல்லது உங்களுக்கு.
சரி சரி.
நான் 2 நாள் முன்னாடி தான் அங்கேருந்து வந்தேன். அதனால எனக்கு தெரியும் அங்க கோல்டா இருக்குன்னு சொல்லிட்டு தெரியும் எனக்கு. உங்களுக்கு கோல்டு ஒத்துக்காது அப்படின்னா அதுக்கு ஏற்ற மாதிரி நீங்க ட்ரெஸ் சேஞ்ச் பண்ணிக்கங்க. உங்க அந்த காதெல்லாம் அடைச்சு வச்சுக்கங்க. காதுல பஞ்சு போட்டோ இல்லை அந்த காதுல அந்த இது போட்டோ அடைச்சு வச்சுக்கோங்க. பட் உங்களுக்கு ஃப்ரெஷ் ஏர் வேணும். நல்லா ஃப்ரெஷ் ஏர் வர்ற மாதிரி விண்டோவும் டோரும் ஓப்பன் பண்ணி வச்சுக்கங்க.
சரி பண்ணிக்கிறேன்.
Dr. Vinay Prabhu, we are still waiting for the medicine name which you have recommended and the blood pressure this thing which we will arrange.
Yeah, I'll write down my recommendations right on the group right now. So prednisone, 10 milligrams twice per day. Number 1. Number 2 is increase Lantus to 18 units at night.
18.
Yeah, 18 units at night. And then leave Humalog the same 3 times blood sugar daily. And then we would do a blood pressure daily. And then most important is open the windows.
This Betrazone, please tell them also that when they should eat twice a day in the morning and the night, or morning evening.
So I would have
before prasadam, after prasadam, tell everything so that they are clear.
After prasadam, I would take your 10 milligrams after prasadam and 10 milligrams. Like do it at around. So what time do you eat? 9 o'clock?
Well, no, 9:30, bro.
9:30. Okay, so maybe take it 9:30, and then what time do you stay up till?
Stay up. Okay. 11 o'clock, bro.
Okay, so 9:30. So take it one 9:30, the other 9:30. Let's do this 2-3 days and see if it goes away. Okay?
Okay. Bro, Madhugopal bro, note பண்ணிட்டீங்களா? அது எனக்கு chatting இல்ல.
இல்லையே chatல வரலையே. Prabhu, you have not sent us. Prabhu?
Oh, wrong group. Hold on. That's DH. Hold on. That's HD.
ரத்னாபுரம் அனுப்பிச்சு விடுறேன்.
Okay. Did you see them?
Not yet, Prabhu.
நான் ரத்னாபுரம் அனுப்பிச்சு விட்டுருக்கேன்.
பிரபு குரூப்ல வந்திருக்கு. மதுகோபால் பிரபு குரூப்ல வந்திருக்கு. நம்ம வாட்ஸ்அப் குரூப்ல.
Okay. Thank you. Right, Prabhu. Done.
Okay.
மதுகோபால் பிரபு.
சொல்லுங்க பிரபு.
நான் ரத்னாகர் பிரபு வாட்ஸ்அப்க்கு அனுப்பிச்சு விட்டுருக்கேன்.
நன்றி பிரபு.
வந்திருக்கு. ஹரே கிருஷ்ணா என்னோட குரூப் நேம்ல வந்திருக்கு. And Dr. Vinay Prabhu, thank you very much. I received on the group as well.
Would you like to know the diet of Srinivasari Prabhu? Sorry.
So yeah, this is something it's very interesting. The problem is his diabetologist should really figure out his diet. I would rather, because of their expertise, but I would think that staying away from heavy foods during the next 3 days is a good thing. Keep your blood sugar normal. Don't take too much carbohydrate, and that's basically it. But obviously, diet is a huge component of this. What I do tell a lot of people, but I'm not sure if you're going to be able to do this, is stay away from grain. A lot of grain. Sometimes that triggers headaches, causes inflammation in the brain. But it's just not sort of proven. It's not. There's no like randomized clinical trial that says that this is there. It's something I've been noticing with my patients that has told me that if they stay away from grains and other triggers, sometimes that helps. Are you able to stay away from grain?
Actually, I'm taking only millets, bro. Millets only I'm taking, not taking the rice.
Okay. Yeah. The problem is that staying away from grain then also will put you in a position where you may be taking too much fruit, and that may spike your blood pressure. So I want to be very careful as far as the dietary recommendations, because your diabetologist and your nutritionist should give you those recommendations. Okay.
Hare Krishna, Vinay Prabhu.
Yeah, go ahead.
Pronounce.
Oh, Haribol, Haribol. This is
Sorry,
Bishop
it's
Prime.
Vaishnav. Haribol.
Haribol.
Prabhu, is there any infective causes? Because they were saying that he had spikes of temperature and things like that.
Yeah, I don't think he has temperature anymore, no?
No temperature, bro.
I don't think
Okay.
I don't think fever is there. No, I was thinking the same, and I was thinking possible meningitis. I agree. But then he said, as far as nuchal rigidity is concerned, he said he's had neck pain, but that's been there before. So I was thinking,
Okay.
I think, you know, it's absolutely a good thought. Is it possibly some sort of COVID, sort of meningitic, aseptic meningitis type situation where we just let it ride and then go from there.
Right.
But I think it's safe that we probably just give him some steroids, unless you disagree, Vishnu. We can.
No, it's fine. Let's go with the steroids initially and take it from there, bro.
Yeah,
Definitely.
I was thinking, we could also just give him one dose of 250 milligrams of IV solumedrol and just give him a pulse dose. But then the problem is that if we spike his sugar, we could also do Depakote. Do you have liver enzymes already drawn where they've taken liver tests?
Madhugopal Prabhu.
Bro.
அவருடைய லேப் ரிப்போர்ட்
Hare
இருக்கா?
Krishna.
அவருடைய லேப் ரிப்போர்ட் இருக்கா உங்கள்கிட்ட? KFT LFT எடுத்துருக்காங்களா?
PSG ல எடுத்த ரிப்போர்ட் ரீச் பண்ணலாம் ப்ரோ, உங்களோட ஷேர் பண்ணிக்கலாம் ப்ரோ. இப்போ
நீங்க அந்த லேப் ரிப்போர்ட் அனுப்பிச்சு குரூப்ல போட்டு விடுங்க.
ஓகே ப்ரோ, பண்ணிடலாம்.
They have done his labs in PSG, so you can actually see his labs, what they have done.
Do they post the lab? Did I miss that?
No, they have not posted. They will post it.
Okay. So post the labs. Let's stick, if Vaishnav Prabhu agrees, let's stick with the 10 milligrams in the AM, 10 milligrams in the PM for headache. See if that goes away. And if that doesn't work, we'll try Depakote. If that doesn't work, we'll go to the hospital.
Okay, that's fine.
Okay.
And he was mentioning loose stool and dysentery. Was there any blood in your stool, Srinivas Prabhu?
No bleeding, Prabhu.
Nothing, just loose motions, yeah?
Yes. 4 times it is happening. Even dysentery also, it is normal motion only is coming, but it is happening 4 times in a day.
Okay, no, that's fine. Look, Vinay Prabhu, I agree with you. Let's go with the solumedrol as you suggested, and then we'll take it from there. We'll watch it over 24 hours. If that's okay with you.
I think we're just going to do 10 milligrams of prednisone. We're not going to.
10.
Is that okay? Because if we do the solumedrol, then we may spike the sugar and then send him definitely to the hospital. So I'm just going to take
that's fine.
Let's do 10. And then maybe that'll
that's fine, Prabhu.
Inflammation in both the gut and in the brain, or whatever's irritating, across the blood-brain barrier.
Yeah, no, that'll be fine.
Okay?
Okay, bro. Over on my side.
Okay.
All right, Prabhu.
Okay. All right. Sounds good. All right. Thank you.
Thank you, bro. Thank you, bro. Direction.
Thank you, Vinay Prabhu and Vaishnav Pran Prabhu, for your.
Sorry, I joined you late.
Thank you, Hari Leela Prabhu. All right. Thank you.
Haribol, Hari Leela Prabhu.
Direction.
Maybe you can send me the name of the doctor at PSG, and we can get in touch with the PSG doctor just to inform them. I can send him a quick note. If you send me his number, I can send him a note of what our plan is and see if we have agreement. Yes? No? Maybe?
Oh, sure.
Okay.
We can do that. Yeah, sure.
Keep in communication with this ground doctor, no?
Okay.
Thank you.
Right.
Okay.
Haribol, Srinivasari Prabhu, வேற ஏதாவது கேட்கணுமா உங்களுக்கு? You have anything else doubt?
இல்ல வேற ஒண்ணும் இல்ல ப்ரோ, அவ்வளவுதான் ப்ரோ.
Okay. Madhugopal Prabhu, you want to add anything further?
Somebody.
Done, bro.
Okay. Rasika Gaur Prabhu.
The Prabhu, Dr. Vinay wanted to have a head scan done. Is there a timeline for it, Prabhu?
I don't want to send him back for a head scan to give him COVID-19 again, especially in India and the Bangalore situation. Let's wait.
Okay.
Get better.
Okay,
the point. What am I going to change? If things get worse, then we have an issue, right?
Okay. Right, Prabhu. Right.
All right, Prabhu. Hari Leela Prabhu, you have something to say?
is I think Muralidharan Prabhu did join the meeting. He said, keep the door closed. No one should hang outside the window. So if the door is open, is the window to the outside? He's making a good point. Dr. Muralidharan made a point saying, is he keeping the door on the outside also? What he means is the window directly to the outside where it's breezy air, or is the window directly to a hallway where there's other people that are hanging out?
Actually, door opposite to the door, window is there. Window is in the back side.
அவருக்கு காமிச்சிருங்க ப்ரோ, சீனிவாசரி ப்ரோ காமிச்சிருங்க கேமரால.
Okay. This is the door actually. I am sitting back side of the door only. This is the door, and straight opposite is a window.
பிரபு அதை காமிச்சிருங்க, அந்த விண்டோ கேமரா திருப்பி காமிச்சிருங்க அந்த விண்டோ.
I'm understanding, but I just want to make sure. Now, does the window go directly outside, or is there people that can congregate there? Can somebody explain? Can somebody translate?
கேக்குறாருன்னா, நீங்க கதவை திறந்து வச்சீங்கன்னா, ஜன்னலை திறந்து வச்சீங்கன்னா, அங்க யாராவது வர முடியும் போக முடியுமா, இல்ல டைரக்டா வந்து ஓபன் பண்ணனும் என்விரான்மென்ட் காத்தோட்டமா இருக்குதா? அது நீங்க போய் ஜன்னல்
if we open the window, outside is just one big building. Big building is there, and very short distance is there to the next building.
Yeah. Prabhu, if you can turn your camera around and just show us exactly what is the situation.
That is the window, Prabhu.
Right. And where does it?
Yes, Prabhu. You have seen that? This is the window. And this is the door. Window also, I will open it under. One second. This is the window, outside of the window. Outside of the window.
Okay, so it sounds like there's two buildings, and there's a
Yes, Prabhu.
There's a drop below. Nobody can stay there. No?
Nobody can stay there.
Okay.
Yes.
Okay. So yeah, I think that's okay. Okay. Yeah. Keep that window open. Get fresh air. Okay.
Right, Prabhu. Okay.
Ugram Vidam will help.
Ugram Viram and Panchatattva.
Okay. Definitely. Like 432 times, your headache may go away. Okay.
Right. Correction. Thank you.
All glories to Srila Prabhupada.
Hare Krishna. Thank you very much.
All glories to Srila Prabhupada.
Correction.